So in this video, I'm going to show you how you can use a muscle energy technique to promote some extension at the CT junction. And so there's lots of different ways you can treat this area. You can do some bony contours to it. I do a lot of manipulation here just because this junction gets really, really stiff. But with someone that's a little bit more hypermobile, I like a muscle energy technique because I'm creating some more stability of the system while I'm also mobilizing. Okay. And so in sitting, the reason I would want to do this treatment would be that someone can't get their chin all the way to their chest, and Juliana can't. She does have a longer cervical spine, so she has a long neck that she's having to stabilize through too. She is hypermobile, so we're going to be careful. But typically, if someone cannot fold appropriately and get their chin to their chest, it might be a restriction at the CT junction. You can also look and see how do they look up to the ceiling. Do they actually extend? She actually does extend some. Some people you will see will just hinge right at around their C5, 6, and no movement happens from here. And so these are also patients that I'm doing this technique on. And so what you will do is use a key grip. And so you want the spinous process to be in between your thumb and the first knuckle of your hand. And so I kind of get the skin and kind of pinch it a little bit so that I have a skin tissue lock. And then I'm going to, again, scoop the occiput. I'm going to bring her into CV flexion to protect her neck as long as it's available. And I'm going to retract her back through her entire cervical spine to where I feel tension come into my finger. And again, she has a longer neck, so it's a little bit harder to control. So we'll go here. I'm going to push forwards with my left hand while I have her resist CV extension. So relax for me, Juliana. CV flex, retract. Now don't let me pull your head up towards the ceiling. Gently meet my resistance. And relax. As she's relaxing, I'm taking up the slack while pushing forward. And again, don't let me pull you up. And relax. And so as she relaxes, I do more of that kind of, it almost looks like a shear, but I'm blocking and moving and creating more extension here. And then now look up for me. You should see there's actually a little bit better extension here, and look down towards the floor. She does get a little bit closer, even flexion, even though I wasn't encouraging flexion there. But that's a nice, gentler way to work on the CT junction, especially if someone's a little bit more acute.